It may seem like a small gathering at the School of Nursing, University College Hospital, Ibadan, but it's a forum of professionals with profound effect on life preservation. There are physicists from different parts of Nigeria discussing ways of achieving better management of cancer and reduction of its burden. Interestingly, there are just about 40 of them in the country, catering to the staggering 233,000 people in need of cancer care.
I see the role of medical physics very crucial, not only in cancer care, but also in addressing the complex nexus that exists between the major determinants of health and well-being and all the SDGs. And this must have to be well understood. Just like the other health professionals, I notice that the membership of this association is still very low in relation to our population, over about 200 million. And in relation to the strategic needs for this profession, currently the number stood at around 40 of people, of practitioners in this field. This is very grossly inadequate. So this calls for concern. We must therefore work together to grow this number while repositioning the profession to greater heights, involving sustainable career development so that the profession is also recognized as a standing profession in the healthcare delivery system.
The annual scientific conference of physicists also seeks to draw attention to the shortage of experts in the field and garner support for increased training.
More still needs to be done, unfortunately. The number of the physicists in the country are still way too small, and there is the serious and urgent need to really grow the number. But that cannot happen unless probably the bill, the Nigerian Association of Medical Physics bill, is actually passed. And unfortunately, I really don't know if that is really going to happen with this National Assembly that is already on its, winding up. But be that as it may, it's really within the overarching interest of the government that even whether executive bill or no executive bill, they need to really put this bill in place so as to regulate the affairs of this very critical sector in the country is really very paramount.
Addressing the issue of cancer burden is a global nightmare, as more than 19 million new cases were reported in 2020 alone, with an even more scary figure of 10 million deaths recorded in the same year. The experts want efforts to be scaled up to save more lives, especially low and medium income earners who can barely afford this treatment.